Why can the leg hurt if the issue starts in the back? Why does pain in the lower limbs sometimes appear when the root cause lies in the spine? And why, after back discomfort decreases, does aching in the legs suddenly begin? The explanation is straightforward. The human body functions as one integrated network. Myofascial chains extend from the sole of the foot all the way to the cervical region. The lumbar spine plays a key role in providing nerve input to the lower extremities. When signal transmission is disturbed at the lower back level, impulses from the leg muscles cannot properly reach the central nervous system. As soon as this pathway between the periphery and the brain is reestablished, normal performance and well-being gradually recover. All muscles operate as a unified system. Frequently, people consult me with the same concern, leg pain that developed after spinal treatment. They often receive various labels: osteochondrosis, disc herniation, protrusion, spinal canal narrowing, and others. However, terminology is less important than understanding why leg discomfort may arise once back pain subsides. Sometimes patients are frightened with statements that without ongoing injections, the leg may fail or paralysis could develop. In most cases, this is simply a misunderstanding of how pain works. The body is a single interconnected structure. If you look at the anatomy, you'll see that muscles are linked from the heel up to the neck. I emphasize muscles because the main neurovascular pathways run through them. What is the spine? It is a protective framework for the spinal cord, the central component of the nervous system. The cervical region regulates the upper body, the thoracic region manages the trunk, and the lumbar area supplies the lower limbs. When back discomfort occurs, the signal originates from specialized pain receptors located within muscle tissue. This nociceptive signaling connects spinal nerve roots with peripheral nerves leaving the spinal cord, especially the sciatic nerve and its branches. Everything begins in the spinal region. Back muscles generate pain signals. Imaging studies may reveal hernias or disc bulges, yet in many cases the primary source is muscular tension. The lumbar back muscles form a powerful complex rich in vessels and nerve fibers. If these muscles tighten due to sudden movement, or conversely from prolonged immobility, nerve impulse delivery to the leg becomes disrupted.
Nerve fibers themselves do not actually feel pain because they lack pain receptors. If conduction is blocked in the lumbar zone, signals from the lower limb muscles fail to reach the spinal cord and brain. This leads to sensations such as tingling, burning, numbness, aching, or decreased sensitivity. Excessive use of medication or frequent nerve blocks can sometimes aggravate the problem. Muscle performance weakens, circulation slows, and numbness intensifies. The underlying issue is impaired neuromuscular communication between the spine and the legs. Spasm in the lumbar musculature creates a functional barrier. Walking becomes uncomfortable, and anxiety may appear. Once a person realizes the problem is not a pinched nerve, but rather dysfunction of the muscles responsible for nourishing and supplying the limb, the treatment strategy shifts. The focus moves towards restoring proper blood circulation in the spinal muscles. Muscle tissue is self-regulating and capable of recovery. Blood flow delivers nutrients precisely to muscles that are actively engaged. When muscle control diminishes, circulation slows, similar to a traffic signal stuck on red. The leg may feel numb and gradual muscle wasting can begin. Therefore, attention should not center solely on the leg, but on the spinal muscles that have stopped adequately supporting it. Symptoms can differ: burning, tingling, weakness in the foot. The priority is to prevent progression to serious dysfunction. Leg is appropriately chosen physical exercise targeting both the lumbar spine and lower extremities. I often suggest two basic movements that restore the kinetic chain from foot to neck. One is performed lying on the back with the lower leg stabilized, slowly raising and lowering the legs. This produces deep stretching of the calf muscles, quadriceps, hamstrings, and gluteal group, stimulates circulation, and reactivates neural input.
When we consciously control the leg muscles through movement, sensitivity gradually improves. Specialized equipment may allow motions that are difficult without support. Simple leg swings are usually insufficient when numbness is present. Deep stretching along the entire muscular chain, reaching into the lower back, activates systemic blood flow in both the spine and legs. The exercise load should permit at least 20 repetitions, with gradual increases over time. Activating the muscular pump of the leg enhances circulation and restores neuromuscular signaling. Consequently, pain often subsides without the need for injections or nerve blocks that interfere with the body's natural regulation. When the functional link between peripheral tissues and the central nervous system is restored, recovery follows. The duration depends on overall physical conditioning. The better the deep leg muscles function, the more efficiently the spine works. The lower limb contains 3 muscular layers through which arteries, veins, and nerves pass. When these muscles perform effectively, spinal health improves as well. Through targeted leg exercises, lumbar tension decreases, pain diminishes, and the rehabilitation process begins. If you still have questions, you are welcome to share them in the comments.